In 2010, she did a postgraduate course at the biotechnology and interdisciplinary department of the University of Graz. Did a course with Professor Blanche. She got a master's degree, and her master thesis was about the estimation of the difference between nocturnal sleep of praxis and diurnal parafunctional activity of human. In 2010, she did a course with Professor Sardo about orthodontics in craniofacial dysfunction. She has her own private dental center in Venice. Please, Natalia.
Thank you for introducing it. I'm so happy to be here. And I want to support the VieSID. I want to see my teachers. It's very important to me. So I decided to bring you a difficult case. And I bring my mistakes, I bring my thoughts, I bring my lessons, and finally I bring my visions. So look at this young lady, 34 years. It was 2016. A very nice, very calm evening, summer, good weather, and this lady was on bicycle travel. And this evening ended by falling down, and she turned over the bicycle. The main complaints was severe dull pain. It was stingy, of course, it's understandable. Open mouth invitation, 90 millimeters only. Speech and chewing problem, headache and sleep problem. It was the day of my vacation, and my partner called me and asked me to come back because we have a problem with our surgeon. She is my implantologist. So I canceled my vacation and come back to office because it was a very acute situation for us. So look at this picture I got from emergency department. It just put the special virus, emergency virus in the mouth, and you can see the open mouth or open wide, absence of two condyles. So we decided to prepare the CT, and we found not only the fracture of both condyles, but also the two big problems in the middle of the lower jaw and cracks on the upper jaw near the first incisors, so many cracks in the enamel. The pain was everywhere. At that time it was not useful for me because it was one day after the accident and she took the remedies. So I had no chance to prepare the special separate models. So it's difficult to measure, such as life. It's very near the condyle. It's very steep anterior guidance. It's huge anterior guidance, close to the mandible. We have a narrow upper, absence of the first premolars, and also lower arch, and more important, I fight with these nice incisors. The contact was only the 1-7 tooth and second 7, and nothing more. The occlusion on the buccal segment, no good contact, only contact near the canines and the incisors. And look at this red color. I never see it before. And problem list: teeth, mandible, maxilla, acute trauma, pain, dorsal skeletal type, 38 and 34 wisdom teeth are not extracted on the lower jaw. Open mouth limitation and extracted premolars during previous orthodontic treatment. Very steep posterior occlusal plane, right and left more than 20 degrees. Steep anterior guidance, narrow up and lower dental arches, and muscles problem. So, what can we do? And this is the first questions for my auditorium for you. Please, what we are going to do and what treatment options come to your mind? What do you think about this situation? Please.
I think that we can do the sprint. High sprint.
High sprint. Yes, interesting suggestion, sure.
So to distract it and to give the possible to the muscles to reposition the condyle.
Yes, it's great. We have discussed with many, not many, 4 surgeons because we have limited in time, because it was one day after the trauma. Almost all of them insisted to to the surgery. And this is to the surgeon way of thinking. So first one explain, the second one in the surgery. The treatment plan. First of all, change the system of the mandible fixation to the bracket system, because you see the very terrible virus, emergency virus. Time for healing. Sure, and then we can extract the wisdom tooth on the lower jaw and open the right to allow mandible forward adaptation and unload the TMG. Occlusal plate flexion, occlusal support in new position of the mandible, and restore the control of the mandible, because we have not the first premolars. It was a problem. So it was a difficult decision, but I have no chance, because my father, my teacher, Professor Slavchik and Professor Zava, and I started to think, and it was my dream. I started thought what I want to do for my patients. During the treatment, I decided to open the bite, to provide the mandible adapt forward, and to make the compression in TMG area. And first of all, it was important to formate a very nice arch, upper dental arch fold. Happening now. This is 2 years later, so it was in 2020. So it's now. You see the nice lady. She is happy. Good form, good occlusion. You can compare the first models with emergency wires, and finally we'll buy the new CT. It's final step. You can see that we changed the skeletally our patient. Finally, it was a big challenge for me. This is not the best my case, but I so appreciate, because it's a big experience for me. First of all, I think close treatment of bilateral fractures of the mandible condyle in adults is possible. So here you see my patient is happy, and she's still at my dental office. She has very nice 2 dogs, and every time traveling from one country to another country, because there are some competitions and so on. And Professor Slavchik always touched my hand when I come here and asked me, tell me please about your educational center, tell me please about the dentists and about your problems and so on. And finally asked me, it works? It works. So my answer, you are right, dear professor, at all this moment.
Thank you, Natalia, for this difficult case.